In every healthcare setting, from busy emergency rooms to quiet community clinics, nursing remains the steady force that holds patient care together. Beyond clinical skills and medical knowledge, one element shapes the quality of care more than anything else: communication. And behind that communication lies a set of ethical and professional principles that guide every nurse's actions. This audiobook explores the power of communication, the principles that guide nursing practice, and the essential communication principles that make care effective, compassionate, and safe. Chapter 1: The Power of Communication in Nursing. Communication is the lifeline of nursing. It is more than exchanging words, it is understanding, connecting, and responding with purpose. A nurse communicates through spoken language, body language, tone, and presence. A single conversation can ease fear, clarify confusion, or prevent a dangerous error. When communication is strong, care becomes safer. When communication is compassionate, care becomes human. Chapter 2: Building Trust Through Connection. Trust is not automatic, it is earned. Patients often enter the healthcare system feeling vulnerable, uncertain, or afraid. A nurse's ability to communicate with empathy and clarity can transform that fear into confidence. Trust grows when patients feel heard. It grows when information is shared honestly. It grows when nurses show respect, patience, and understanding. A trusting relationship encourages patients to speak openly, follow instructions, and participate in their own healing. Chapter 3: Principles of Communication. Effective communication follows a set of universal principles. These principles help nurses deliver messages clearly, respectfully, and accurately. Clarity. Messages must be simple and easy to understand. Clear communication prevents confusion and reduces errors. Conciseness. Say what needs to be said, no more, no less. This keeps communication focused and efficient. Completeness. Provide all necessary information so the patient or team member can act confidently. Correctness. Use accurate information and appropriate language. Correct communication builds trust and credibility. Courtesy. Respect, empathy, and politeness strengthen relationships and reduce conflict. Consideration. Tailor communication to the listener's needs, emotions, and background. Concreteness. Use specific, detailed information rather than vague statements. Feedback. Communication is a two-way process. Encouraging questions ensures understanding. Active listening. Listening with full attention shows respect and helps nurses understand patient needs more deeply. Choosing the right channel. Some messages require face-to-face conversation, while others may be appropriate for written or electronic communication. These principles form the foundation of effective communication in nursing and beyond. Chapter 4: Ethical Principles that Guide Nursing Practice. Nursing is grounded in ethical principles that protect patients and guide professional behavior. Autonomy. Patients have the right to make decisions about their own care. Beneficence. Nurses act in the best interest of the patient. Non-maleficence. Do no harm, physically, emotionally, or psychologically. Justice. Every patient deserves fair and equal treatment. Confidentiality. Patient information must be protected and respected. Accountability. Nurses take responsibility for their actions and decisions. These principles ensure that nursing care is safe, ethical, and patient-centered. Chapter 5: When Communication and Principles Work Together. Communication and ethical principles are deeply connected. They do not operate separately, they strengthen each other. Respect for autonomy requires clear explanations. Beneficence requires empathy. Non-maleficence requires accurate communication to avoid harm. Justice requires unbiased, respectful communication. Confidentiality requires discretion. Accountability requires honesty. When communication aligns with ethical principles, nursing becomes more than a profession, it becomes a commitment to humanity. Chapter 6: The Human Side of Nursing. Behind every diagnosis is a person. Behind every chart is a story. Nurses witness moments of joy, fear, loss, and resilience. Communication allows nurses to connect with patients on a human level. A gentle tone can calm anxiety. A clear explanation can empower a family. A moment of listening can change someone's day. This is the art of nursing, the part that cannot be measured, but can always be felt. Nursing is built on science, skill, and knowledge. But its heart lies in communication and ethical principles. When nurses speak with clarity, listen with empathy, and act with integrity, they do more than provide care, they create healing experiences. This is the heart of nursing. This is the power of communication. And this is the legacy carried by every nurse who chooses to care.